I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. When to do a pregnancy test? This is a question most couples who are anxious to get pregnant ask us. Let's try to understand this question. To understand this, you have to understand the physiology of reproduction. So basically, when an egg is released from the ovary, it waits in the tubes for sperms to arrive there, or if they're already there, then a single sperm enters the egg. This process is called fertilization. About 3 to 5 days later, this egg which has got the sperm inside undergoes multiple divisions. They form cells, and from cells become multiple cells, and this goes on and on. On the 5th day, this embryo which is formed is called as a blastocyst. This blastocyst on the 5th or 6th day moves down the tubes into the uterus and implants there. The blastocyst is made up of two types of cells. One which is called the inner cell mass, and it forms the baby, and the outer cells which are called as trophectoderm, which forms the placenta. This placenta interacts with the uterine lining or the endometrium, and it invaginates, as in it penetrates deeper, and this process is called as implantation. As it implants itself, the trophectoderm, when interacting with the uterine lining, releases a hormone called HCG. As the pregnancy advances, HCG also increases in the blood. Now, when can you know that pregnancy is positive? After numerous studies have been done, and it has been concluded that after ovulation, minimum 6 days is required for this HCG hormone value to increase in the blood, and a maximum of 12 days, as in that is the minimum time required. Of course, later also you can get to know whether you're pregnant or not, provided it's a viable pregnancy. So how do you do this test? There are two types. It's either urine test or blood test. A urine test takes a little bit of time. You have to understand that when HCG is released, it passes through the kidney, it is processed, and then comes out in the urine. So this takes a longer time than when this hormone is detected in the blood. So a blood test of HCG, which is called as beta HCG, is faster detected than a urine test. Now the values may be elevated if it's a twin pregnancy. So when both the pregnancies are healthy and the baby is implanting well, the beta HCG value is also higher. When it comes to an IVF pregnancy or IUI, these procedures which are for fertility and enhancement, we require about 14 days time to do a beta HCG test. This is ideal because when we put back embryos into the uterus, or we ask you to try naturally, or we have done an IUI when the sperms are put into the uterus, the better or the best time to do a blood test for pregnancy is 14 days after the procedure. If you want to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.